welcome to another episode of the Homage Web Series. My name is Joki, and I'll be your host for this week. In today's episode, we will be talking about cervical health with none other than Professor Dr. Woo Yin Ling. Hi, Dr. Woo. Thank you for joining us today.
Hi, Joakim.
All right, before we begin, let me give a brief introduction of our special guest. Dr. Woo is a consultant gynecological oncologist at University Malaya Medical Centre and a professor at the Department of Obstetrics and Gynecology of University Malaya. She completed her PhD degree back in 2008 at the University of Cambridge and received multiple international awards, including the FIGO Award given by the International Federation of Gynecology and Obstetrics in 2021 for her contribution to the development of women's health research. She's also the founding trustee for the Rose Foundation, a program that was designed to make cervical screening more accessible to women. Wow, congratulations on all your achievements, Doctor.
Thank you.
It's a privilege to have you to discuss today's topic of cervical cancer, the top 3 most common cancer among women. Specifically, we look into how a woman can check if her cervix is healthy. So without further ado, let's begin with the first question. Dr. Woo, can you tell us what are the common cervical problems for females?
There are many different issues that can occur at the cervix, from simple infections or pregnancy-related complications, or for this purpose of this session, we're talking about pre-cancer change and cancer of the cervix and how women can prevent it. So as you rightly highlighted just now, cervix cancer is one of the most common cancers among women in Malaysia. This is unfortunate because it is a cancer that can be prevented and treated very effectively if detected early. In fact, the World Health Organization has announced that this is the first cancer in the history of mankind that can be eliminated in our lifetime. So you and I can possibly see the elimination of cervical cancer within our lifetime.
To tell us a bit more about the abnormal cervical cells, are there any signs that we can look out for?
Just give a quick tuition 101, right, on cervical cancer development and the pathology. So one very common infection that most women who have ever had sex would have is something called human papilloma virus. Now, it's not the traditional or conventional, what we call sexually transmitted disease, because most women can clear the infection and it's not an issue at all. In fact, we have information to say that both men and women will have HPV in 80% of them some point in their lives. Now, for a certain group of women where their immune system may be weak or for some reasons that we have not learned about yet, the infection is not cleared from the cervix. And if the infection is on the cervix, they don't have any symptoms like discharge or anything like that. There's no itch. If the HPV, in short, if it's on the cervix skin for a long time, what we call persistent HPV infection, it can lead to progressive changes or progressive abnormal changes on the cervix, which over a 10 to 15-year period can lead to cancer of the cervix. So you can see that this sort of time frame from getting persistent infection to cervical cancer is a very long time, which then allows us a window to detect any potential abnormality. Now, there are some women who may have immune system issues such as transplant patients or patients who need to be on steroids for long term, or if they are immune suppressed, they may take a shorter period of time to develop this. But overall, in general, there's a period of time where we can detect and we can treat very effectively. So this is good news for lots of women.
I see. Yes, so we should not be waiting to see if there are any signs, but we should be going for cervical screening regularly so that any signs can be detected early.
Yeah. So the notion that you go and see a doctor when there's some symptoms, that's not a screening test, that's more so looking for a diagnosis. So when we talk about cervical screening, it's very counterintuitive because you have to carve time out from your busy lives and you have to go and see the doctor or a healthcare professional and get screened when you're actually well. In fact, cervix cancer at the very early stages can be completely asymptomatic with very minimal changes such as spotting in between periods, spotting after sex, or spotting when you're postmenopausal. So these are more common symptoms, but for quite a large proportion of women, early cervix cancer is asymptomatic, no symptoms whatsoever.
Will there be a tumor? Will we be able to feel it?
No. So for early changes, what we call stage 1A and 1B1, the tumors are actually usually very small and often can't be seen by the naked eye. Even often when a doctor puts in a speculum, you may not see early changes for cervix cancer. 1A1, you need something like a colposcopy whereby the gynecologist looks at the cervix with a microscope where the magnification is up to 70 times. Then you look at changes on the skin of the cervix. So early changes, very difficult to detect and you may not feel anything. Now for stages where the cancer is a bit bigger, and in women who are familiar with their own anatomy, they may gently insert a finger, they can feel something. But other than that, you won't feel anything protruding out. There's no symptoms outside in the skin of the lady that will indicate that there's cervix cancer.
Great advice, Dr. Wu. The cervix is an incredible part of the female anatomy, and as women, I think it's important to educate ourselves about the cervix and take the necessary steps to ensure our cervical health. What kind of support or resources are available to Malaysian women out there?
Malaysian women are actually very fortunate. Most of the time, it is our fear of the unknown that delays screening. But our Ministry of Health, actually, if you walk into any clinic kesihatan, you can do the conventional pap smear for free. And you go to your own gynecologist. You can also do cervical screening. So among Malaysian women, actually, there are many avenues for screening tests. And now with the advent of HPV testing, some clinics will also have that test available for women to do regular screening. So that is one aspect, screening. And the second thing where Malaysia adolescent girls are also very fortunate is that since 2010, our Form 1 girls who are 13-year-olds have been offered free HPV vaccines since then. So those who are born from 1997 above would have had free vaccines against cervical cancer given in school, and that is in the long run will prevent them from getting cancers, but not 100%, but it will reduce it significantly.
All right. For those of you who are interested, you can check out the recommendations in the links provided. And Homage is home to professional caregivers who deliver home care services to seniors and adults in Malaysia. What advice would you give to our caregivers who are tuning in? How can they better support those with cervical cancer or cervical disorder?
I always challenge everyone I speak to, not just your carers in Homage, but for every individual in Malaysia. If you're a husband or if you're a child, if there's any precious sort of females, your mother, your sisters, your wives, your good girlfriends around who are of screening age, they should be encouraged to go for screening tests. Now, for those who have cervix cancer, one of the main things or main ways we can provide support is not to stigmatize. I think we read a lot on the internet and we get information that's perhaps not very accurate, and we stigmatize patients with cervical cancer. Women who have cancers from the female genital tract go through different stresses, and as carers for them, or even as husbands of women with gynecological cancers, they should be supportive. So your carers should understand that even after treatment, within the confines of a marriage, they are able to make love again. There are ways to help women who have had cervix cancer, how to make it more comfortable and not to be afraid of pain and not afraid that they will hurt themselves, how to clean themselves, how to look after the skin around the vulva and vagina. and also discuss with their doctors the availability or whether they can use hormone replacement therapy if they've been made menopausal at a very young age. So there are many ways you can actually support a woman who has gone through surgery or radiotherapy or treatment for cervix cancer. A lot of these are misconceptions we need to remove.
That's right. Not only is it important to eliminate stigmatization of women, but it's a corporate responsibility to also empower them, look for the resources that they need. All right, one more question before we move on to the next session is can I do my own pap smear? Nowadays, the trend is to DIY everything, and we even have COVID self-test kits now. So, doctor, is there a DIY pap smear kit?
Yes, there is. Interesting that you should ask. So, cervical screening lends itself very well to the self-care concept as introduced and promoted by the World Health Organization. Self-care is defined as the ability of the individual, the family, or the community to prevent disease, look after their health in the absence or presence of healthcare professionals. There are a few things that are suitable for self-care, and cervical screening is now one of them. Using your analogy of COVID self-testing, you can now do HPV PCR self-testing yourself. So I'm going to give you an example, what we call a self-swab, and there are different swabs you can use that are in the market. You just have to check whether they've been validated or tested very well in clinical setting for use. Now, this is a swab that's very simple. It's actually like the COVID swab. So you twist it and you can see it's very soft. It's a cotton tip swab here. And women can hold this red line here and gently insert it into the vagina. It doesn't need to reach the cervix at all. It's very soft. The purpose of this is to capture some DNA, put it into the vagina at an angle that's comfortable. They shouldn't be uncomfortable. They turn it round a few times, like the COVID swab. They take it out and they put it in here, and that swab can be sent for PCR. So everyone has heard of PCR COVID, so that we can use exactly the same machines. We look for HPV PCR. So this can be done very simply using swabs that are used for COVID and tests that are used for COVID, except that we do it for HPV. Now, importantly, you can't buy any cotton tip bud from Guardian or Caring and say, oh, I'm going to use this swab instead. The swabs are very specific so that the DNA is stable and it can be kept in room temperature and to make sure it reaches the laboratory in a good time to be tested. Now, if you hear about your friends talking, there are different types of tests. Oh, they'll say some are not so, when we talk in relation to COVID, they might say some tests are better than others. The sensitivity, you talk about the reliability and accuracy. Now, all those things are also applicable to HPV self-test. You have to ask the question, has this been tested in a clinical setting? Is the PCR test used approved by the World Health Organization or the laboratory bodies? There are more than 200 different types of PCR for HPV, and actually there are only 8 that are approved for self-sampling using specific swabs. So this has to be taken into account. But yes, you can do self-sampling for screening now.
All right. Thanks for sharing your insights, Doctor. So we've come to the final session of this episode where we will address some myth-busting questions about cervical cancer. Okay, so the first one is, can I get HPV from a toilet seat?
That's a big, big myth. So thank you for that question. Many people ask whether sharing beds or sharing a chair or toilet or home amenities with someone who has cervix cancer or whether they can catch HPV. So unlike COVID, where you can breathe it in and you can get it in your respiratory tract, cervix cancer, you can't just sit on a chair or toilet seat and catch it. You actually need micro abrasions. So typically, this would be acquired by sexual activity. So if you say whether sharing sexual toys you can catch HPV, that's a possibility, but not simple contact by sitting down or sharing sort of common furniture. So definitely a big myth.
All right. Okay, the second one is, does cervical cancer cause itching?
No, cervix cancer is, as I said, early stages are pretty much asymptomatic with no symptoms and signs. But if it's bigger in bulk, it can cause pressure symptoms on the bladder, on the bowel, and different bleeding pattern and discharge. But the discharge typically is not itchy. So there's no itching is not a typical complaint. So that's also a myth there.
Okay, and does cervical cancer cause you to pee a lot?
It can, as I said earlier on, so that's a fact. The cervix is very closely related to the bladder and the bowel. If the cervical growth is big, it can press on the bladder and it can cause women to need to go to the toilet frequently. If it's very big and it's pressing on the bowel, sometimes a complaint can be constipation. So yes, occasionally in bigger cancers, it can cause urinary symptoms.
And does cervical cancer only affect older women?
Not true. Cervix cancer can affect younger women as well. In fact, it is the second most common cancer for women under the age of 44. That's why it's so important to take steps to prevent this very preventable cancer, because it usually strikes at the prime of women's life and their productivity, and when they have young children and families to care for.
Last but not least, can using tampons cause cervical cancer?
No. So there are two things that are major myths: tampons, certain sanitary towels, and hygiene. You have to use different washes and hygiene washes. So those things do not lead to cervical cancer. So don't worry about choosing sanitary towels or using tampons. It's HPV that's the primary cause, and those things don't cause cervix cancer.
All right, and that concludes our session. On behalf of Homage, thank you, Dr. Wu, for sharing with us your wisdom and recommendations about the cervix. It's definitely a privilege to have you with us today. And thank you to our audience for joining us. Just a disclaimer, the health information provided is for general information and educational purposes only and is not a substitute for in-person professional health advice. To seek further medical advice for your medical condition, do consult your doctor or go to the nearest health institution to get assistance. This video only represents the speaker's view on cervical health. Thank you once again, and bye.
Bye. Thank you.